Hello, my dear medical students and junior doctors. Today I would talk about Fabry disease in details. So let's see our first slide. Here you can see a skin lesion, but don't worry about it. I will discuss about it later. So Fabry disease is also known as Anderson-Fabry disease, and it was first discovered in 1898 by two different individuals named William Anderson and Johannes Fabry, and they discovered this disease in two different individuals in 1898, but they didn't know anything about the enzyme problem or genetic factors behind this disease until 1960s and 70s. We achieved considerable advancement in molecular biology, electron microscopy and genetics. Then we find out about some genetic problem, for example problem in alpha galactosidase A enzyme. So what happens in Fabry disease is there is a total lack or reduced activity of alpha galactosidase enzyme, and it is a lysosomal enzyme, so it is also categorized as lysosomal storage disease. Since lysosome is present in almost every cells, so it can involve all organs or cells in the body, for example skin, eye, kidney, heart, brain, PNS, etc. So there are more than 600 mutations of the GLA gene, which causes the total lack or reduced activity of galactosidase enzyme. As a result, so there is, you can see the reduced activity of alpha galactosidase. As a result, more and more globotriacyl ceramide or GL3 gets accumulated in the cells, and this GL3 or globotriacyl ceramide is the main culprit causing the features of Fabry disease. They cause structural damage and cellular dysfunction. They directly can cause these problems, and also they can trigger secondary tissue level response such as inflammation, ischemia and hypertrophy. So as a result, they cause organ dysfunction, and it is a X-linked disease, which means most of the Fabry disease cases would be males, but it can also theoretically affect females if the female is homozygous, and it's quite rare disease affecting 1 in 40 to 60,000 males, and it would definitely be even rarer in females, and the typical onset is usually in childhood and adolescence. So here I am again showing you the same skin lesions that I talked about earlier, and this is known as angiokeratoma. I recently seen a Fabry disease patient, and he had these skin lesions. Sometimes this lesion can be painful or itchy. That's why I showed you this lesion in my slide. So here you can see a renal transplant scar, because Fabry disease causes proteinuria and progressive decline in renal function. So they invariably developed CKD at an early stage of their life. So we need to do renal replacement therapy. And here you can see the other features are acroparesthesia, corneal opacities. I would show you a slide showing corneal opacity later, and also ear problems like tinnitus and hearing loss. So in terms of CNS features, it is responsible for almost all type of brain dysfunction. For example, small vessel disease of the brain, ischemic stroke and hemorrhagic stroke both can happen in Fabry disease patient, and it's a cause of young stroke. Microbleeds in the brain, subarachnoid hemorrhage, cerebral venous sinus thrombosis, transient global amnesia, dementia, depression. So mainly Fabry disease can cause all sorts of brain dysfunction. And currently we have two treatments for Fabry disease, I mean Fabry specific treatments. One is recombinant alpha galactosidase enzyme. So we have alpha galactosidase enzyme deficiency, and we create this enzyme by recombinant DNA technology in labs, and we replace this enzyme and it treats the Fabry disease. So generally these patients undergo enzyme replacement every 6 months or 1 year depending on their enzyme level, and they also undergoes follow-up involving enzyme testing every 6 months to 1 year time. There is another drug called migalastat. This is FDA approved at present, and this drug helps the alpha galactosidase enzyme in the body to work better. So if someone has some deficiency of alpha galactosidase enzyme, then migalastat can be useful for that individual. And obviously there are non-Fabry specific treatment. These are the treatments for specific organ damage caused by Fabry disease. For example, CKD. For CKD we can do dialysis, renal replacement therapy, other renal replacement therapies like renal transplant. For cardiac disease, heart failure, heart attack, we can give medications, we can do stenting, we can do bypass surgery, etc., etc. For neurologic pain, we can manage the pain, and for other neurologic symptoms, signs, diseases like stroke, we can treat like by antiplatelets or anticoagulants, whatever is necessary. And for gastrointestinal disease, for malabsorption, we can give some replacement of replacement nutrients. And also other clinical manifestations, for example, corneal opacities, ophthalmologist would treat this condition. And for skin lesions, we can give some anti-itching or analgesic, local analgesic medications. So here you can see now one slide showing the corneal opacities that I talked about earlier in this slide. So this type of opacity is common in Fabry disease. This is again the same skin lesion. Here you can see some left vertebral artery occlusion signs causing some changes in the cerebellum, left cerebellum. And here you can see some vascular deformity caused by the Fabry disease involving posterior circulation of the brain. And how do we monitor Fabry disease? By enzyme level, I already talked about it, and also by some routine tests like full blood count, urinalysis, ECG, echocardiogram, hearing test, and brain imaging, for example CT and MRI. Here you can see a functional MRI of a Fabry disease patient. So what functional MRI is? So researchers tells the patients to do certain movements, for example making a fist and releasing the grip like this, and it triggers the motor cortex of the brain, which is present in the precentral gyrus or area 4, if you think about broadband area, and that cortex is linked to some other structures of the brain by various descending pathways, and also linked to cerebellum because it is also a fine movement. So what happens here is there is reduced activity of some of the areas of the brain in case of Fabry disease, and these areas are presented in red. So reduced functional connectivity with the motor cortex in Fabry disease is shown by the functional MRI. And how do they measure it? Actually, when a certain area of the brain activates, it causes increased oxygen intake in that area. So in case of Fabry disease, in these red areas there is decreased oxygen intake compared to the controls. Here are some data about Fabry disease and stroke. I have taken it from one research paper. Median age of stroke for Fabry disease males is 39 years. Median age at first stroke for females is 45.7 years. So females live a bit longer than males, and 50% of the males and 38.3% of the females experience their first stroke before being diagnosed with Fabry disease. So a lot of cases present with stroke and then get diagnosed with Fabry disease. Total of 6.9% males and 4.3% females experience stroke. I mean, these are Fabry disease patients, and average life expectancy is only 58 years. Here you can see diffusion tensor imaging, and this image is showing reduced fractional anisotropy. So what fractional anisotropy is, this is a measure of indicating the overall directionality of the water diffusion that is greater in organized white matter tracts and lower in CSF and disorganized fibers. So for example, if this is a white matter and a blood vessel is flowing through the white matter, so normally diffusion should occur from the blood vessel, I mean from the inside of the blood vessel to the outside in the white matter. So there is a general directionality of the diffusion of water molecules from inside to outside. But when the blood vessel is considerably damaged and already a lot of water molecules has leaked into the white matter, and in that area inside the white matter, they loses the general directionality of flow. So these water molecules can move in every direction randomly. So this is measured by fractional anisotropy. So in certain white matter areas, there is reduced directionality of the water molecules, which means in other words, there is too much water in the white matter, and these areas are colored as red color. So normally there would be a lot less red in diffusion tensor imaging, but for Fabry disease patients there would be more reds and yellow colors. So this ends this small presentation in Fabry disease. If you have any questions, please feel free to write in the comment section.